Field Hills, Michigan. It's a warm pleasure to welcome one of my patients from 6 months ago. And you basically are so nice and generous to share your journey. Remember, this is a movement by the ladies, for the ladies, so that you will educate the next person. And we want to hear directly from you. Not only we know why the explant is being done. Today I learned of another plastic surgeon who gave up augmentation and was only explanting, and now she's augmenting back again. And this is where do no harm, that's the oath we took. And this is where I say this to you very bluntly, you're my worst case scenario patient. Why do I say that? You had your first set of implants 1998, saline. Back then, the silicone implants were banned and you could only get saline. And then in 2019, you ended up getting another set, which was your second set, silicone, 560 cc's, what is below the muscle. And then you had what were the symptoms of what is breast implant illness. Now, what led you to the explant in March of 2025?
My sister-in-law has terminal cancer, and I believe that it was from the breast implant. She was told that she couldn't have a mammogram. And I've had a couple girlfriends who's had breast cancer and had double mastectomies, and I'm just on a journey of becoming more aware of what I put in my body and on my body. And I truly feel like it was God's leading. I really wasn't having complications. I just felt like I wanted them out. And when I went in to the first surgeon, I was not aware of the M block. And so unfortunately, I just had the implants taken out, which when he went in to do it, one was ruptured. So then I went on the journey of like, oh my goodness, what does this mean when one is ruptured? And that led me down the whole rabbit hole of finally, after 27 years, discovering breast implant illness. And then the more that I researched it, it was unbelievable how all those symptoms was what I was having, and the doctors could not diagnose anything. So for the last 6 years, I felt like I was dying with an unknown cause. And I woke up every morning feeling like I had been drugged. I literally could not even function. And the anxiety.
No, this is after the explant.
Oh, so after the explant.
Right,
I
so
felt,
very important. So 2019, you got the saline implants removed.
Yes.
And then you got the silicone implants. You got hurt with the implants. You said you wanted to remove them.
Yes.
And so in March of 2025,
Yes.
you got the explant done. And
Yes.
this is where your surgeon did not remove the capsules.
Correct.
Now, how much after the explant by the previous surgeon, how much did you improve?
My energy level improved a little bit, but I was still having the fogginess, the autoimmune symptoms, and so just doing further research, I realized that a lot of the toxins are still kept in the capsule and how important it is to have all of that removed.
So this is your symptom list. You had the chronic fatigue, brain fog, muscle aches, pain, weakness. This is after the explant. And this is what I say, you were the worst case scenario in the sense that you already had the explant. Your surgeon did not remove the whole capsule, correct?
Correct.
And you continue to have those symptoms linger on, which was the joint pain, dry skin, eyes, easy bruising, temperature intolerance, autoimmune phenomena, night sweats, rashes, tender lymph nodes, burning around the chest, breast, and all these that are listed in the symptom questionnaire. This is after you had explanted. Because you were asking yourself, how come you're not improving? That's the reason why you got an explant done. Now, you also had what was spilled silicone or ruptured silicone implant in just the 6 years. From 2019 to 25, your right breast implant had ruptured. So there was free floating silicone on the right side. So that was the other challenge. Now, you are 6 months after what are residual capsulectomy. That means the residual capsules have been removed. And this is the surgery that was done on the 15th of May 2025. I actually did a Facebook Live. So you can go to the YouTube Live and the Facebook Live from the 15th of May 2025. And we'll certainly put that up so that you can see this interview. And just like you did, Mar, very well, we will see the Facebook Live from 15th of May to see what was removed. And this was the residual capsule. And this is what I say, is the worst case scenario because you already have undergone an explant and now you come to me with the same set of symptoms that you had as if you had implants.
Right.
And the task was to remove the capsule, what was basically below the muscle directly on top of the rib, and the residual spilled silicone. Now, before the surgery, 0 to 10, how ill were you, let's say on the 14th of May 2025, before the surgery, when I saw you the first time before and pre-op?
I would say I was still a 9.
9, so that was
Mhm.
pretty bad.
Mm-hmm.
How much are you now 6 months later after a residual capsule removal?
I would say 1. My energy level is incredible. I can't believe the difference. And looking back, I can't believe how bad I truly was with depression, anxiety. A huge one is the anxiety was almost debilitating. And now it's just a little anxiety. You get anxious over things and you push through it. And then, obviously no depression, suicidal thoughts are gone. And my energy level, I just really cannot believe it.
Now show
Yeah.
me, you were telling me just very briefly when I examined you, what do you mean by energy level?
For example, typically I would wake up and I did a 5K with a friend. That would be my one event for the day. I could never plan 2 events in one day. And so I joined this active group of people, and a couple Saturdays ago I did a 5K. I went and met them for a hike. We went to lunch, went back home, made some chili, met up with them for a bonfire, and we've just been going. And so my fatigue is justified fatigue. Before it was just like my body just ached so bad, I literally couldn't function. And as I was saying, just even driving 10 hours from Chattanooga today, it would be a miracle if I could make it to right now just to do this interview with you. And I just feel excited. I've been up since 3 o'clock this morning, and it's truly life-changing. Yeah.
Right. Now, let me ask you this. It's been 6 months, so that is behind us. So that's very good. And it's a pleasure to hear your direct feedback because this is your words against everyone else's.
Mhm.
Do you think this is a placebo effect?
No.
How sure are you?
I just the internal, the way that I feel, the way, I kept telling the doctors there's just something wrong with me. And I just I know within myself that, I've done everything that I can do. And between the implants and the capsules, that was 12 pounds of toxins that was removed from my body because I weighed the implants. And then roughly what the capsules were and the fluid and all that.
Inflammation, yeah.
Yes, and the inflammation has gone down. I have friends saying, "Oh my gosh, Karen, what's going on? You look like you've lost so much weight. Your face isn't so inflamed," and you just don't realize all of these things that I was struggling with that are now gone. And I just feel like I've truly got my life back.
So your friends will notice,
Yes.
your pictures will speak for
Yes.
themselves.
Mhm.
I had an anesthesia team member who said, "I don't buy whatever you do." I said, just go look at my patients' faces before and after, and this is not Photoshop faces. These are faces that my patients have posted before and after. And he was totally shocked. He said, that's real. And he said, my patients have nothing to gain except for their good health. These are young moms, nice, energetic, very functional, nice ladies who are an integral part of society, meaning you got a whole life ahead of you, right? Now, so I say to anyone who's listening, the first and foremost proof and witness that the entire capsule must be removed is you,
Yes.
right?
Mhm.
You literally stayed here extra. You are not even supposed to do the Facebook Live, and you're basically speaking from your heart. There is no financial reward or anything. This is just from the goodness of your heart, telling others what the residual capsules removal means to you, and still how you have continued for 6 months, how well you have done. Now, the second proof we have is what was removed on the Facebook Live that day, what I removed from the residual, because you can see it's inflamed, it's grossly abnormal, and it is not healthy tissue just by looking at it and removing it. You also had what was 10 cc's of hazy red fluid that was removed. And remember, this is that fluid on the left intracapsular fluid, and was negative for malignant cells that was sent from that Facebook Live. So first proof is you. Second proof is the grossly what was removed, the residual capsules. Number 3 proof is that pathology report. It says, quote, right breast implant residual capsulectomy, benign fibrous capsular tissue with focal foreign body giant cell granulomatous reaction. And on B, the left breast implant capsule, it says focal foreign body giant cell granulomatous reaction with focal mild chronic inflammation. And this is what was removed on the pathology, and the immunostains for CD30 performed on blocks A1 and B1 do not show any evidence of large atypical lymphocytes. So there was no cancer, no BILCL. So that in itself is telling you that chronic inflammation was removed from the right and left residual capsules that were left behind. And that truly in itself is objective evidence why the capsule needs to be removed. Number 4, you will see the many patients in your similar situation who initially went to doctors and they got the implant removed and partial capsule or an attempt to removal, and the patients did not bounce back, and now they sought out surgeons who did the residual capsulectomy plus that spilled silicone, and then you bounce back. That is another ultimate proof, if you ask me, that the capsule needs to be removed. And then number 5, if you look at the breast implant, certain labeling recommendations to improve patient communication guidance for industry and Food and Drug Administration staff issued September 29, 2020. It says over here on top of page 13, and I'm going to read. This is the guidance, right? It says, systemic symptoms. I understand that some patients who have received breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, rash, memory loss, and brain fog that some patients have called breast implant illness. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with the removal of their implants and surrounding scar tissue capsule. So they're telling you remove that scar tissue capsule. However, not all patients may experience improvement in their symptoms. Now, the bottom line here is if you have someone with a ruptured implant and it has migrated to the silicone, has migrated into the lymph nodes or into the mediastinal chest wall, even when you remove the entire implant capsule, the patients are not benefiting because it's already spilled over to the side. Now, the vast majority of the patients, when the surgery is done right, 90% of the patients seek improvement and benefit from the residual capsulectomy. Now, ideally, your surgeon in March of 2025 should have done it right, thinking that the implant is ruptured. Now, it comes as a total surprise for the surgeons when they go in and they're like, wow, just a 6-year-old set of implants and it's ruptured. Number one, so they're caught by surprise. So the good surgeon, the prepared surgeon, the smarter, wiser surgeon, who is the explant surgeon, is always assuming there is fluid, there is a ruptured implant, and there is badness on the inside. And that's why en bloc is key, because you do not want to find out otherwise. And the next thing you know, you have spilled silicone into the chest, and now you have to do damage control and seek out a surgeon who's going to do residual capsules. The bottom line here is there is a certain etiquette and sophistication to this whole explant surgery, and it is not as simple as, oh, I'll be done by 2 o'clock with 3 or 4 cases. You never know what's going to happen on the OR day, how easy or how tough it is, and this is not uncommon where, look, that one Saturday night in California, in the suburbs where I was operating, I didn't finish till 10 p.m. And this goes on to showing you that when it comes to explant, the surgeon has to always assume the worst. You have to always do the en bloc, and you have to do it all contained. Now, let me ask you this. How confident were you as you came from Tennessee that it was the residual capsules that were giving you trouble? Because that's a big deal if I were you.
By researching it, and I think it was the FDA said in 2019 that it was recommended that that be removed as, you know, the en bloc, meaning the capsule and everything. And just with it holding all the toxins and everything, I just felt like it needed to be out as well. I mean, I didn't want to leave that inside my body.
Right. So that what you're saying is the textbook answer is this.
Yes.
and let me go ahead and read this. So this is the black box warning. The black box warning is like, you can read it everywhere. So let me show you. If you type in Google black box warning, you will see the black box warning.
Which we never see because, you know, the implants are just put in and, you know, they're obviously not showing us the
You never
box.
get to see the box.
No,
Yes.
and all the warnings.
Yes, so this is the black box warning. Black box warning is in this square right here, this rectangle, if you will, the rectangle. So I'm gonna read the black box warning. Breast implants have been associated with the development of a cancer of the immune system called breast implant associated anaplastic large cell lymphoma, BIALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. So the smooth implants are also implicated, but the textured more so, and that's why there was a warning that came out. France banned the textured implants. Some patients have died from BIALCS, close quotes. Now, what they're trying to say is, now remember, to date, almost 1,250 cases have been diagnosed all over the world. If you ask any plastic surgeon or any plastic surgery society, they will say 3 facts. This is underreported,
Absolutely.
big time, because number one, this is the problem. Not many surgeons are removing the capsule. Even if they're removing the capsule, they're not removing it completely. Even if they're not removing it completely, they're not sending it off to pathology. Even when they're sending it off to pathology, they're not doing a CD30 analysis. So now this is being missed. So anytime there is a suspicion for BIALCL, which is the breast implant associated anaplastic large cell lymphoma, the standard of care is to remove the whole capsule tissue along with the implant, so there is no capsule tissue burden remaining behind. Because if the patient has BIALCL and that capsule is left behind, the cancer is left behind. So we are instructed, told, advised, and it is malpractice that if you know that this is BIALCL, you cannot leave the capsule behind, period. Case closed. So it has to physically be removed. Now, in my practice, I say to my patients, last year, I had 3 patients in the last year and a half that were CD30 positive. They got the best surgery to begin with, so there was no me calling them and saying, come here because we need to do the residual capsules. It was already done with. Number 2, the end block was already done, so in those many patients where I've done the end block and there was no spilled silicone, they did not need to wash out the silicone, no need for drains, and it never happened. And you're putting the best foot forward so that and this is being a complete operation, not from picking and choosing patients, but from one patient to the next. Consistently, every patient is treated in a similar fashion. Every patient gets capsules sent to pathology and a complete total capsulectomy, the 100-100-0 rule. Cultures are done for bacteria and fungus. Implants are returned to the patient. In your case, obviously, your implants were removed in March of 2025. Number 4, the twilight deep sedation, no need for drains, no need for the unnecessary lift, and there's complete transparency so you know exactly what was removed and what your chest looks like. This is the single most important factor that your surgery was done correctly, because your surgeon is taking pride and the privilege in showing your chest walls, showing what was removed, how it was removed, and what remains behind. That means only good, healthy, viable tissue, meaning all of that capsular tissue was removed and all that fluid was removed. Now let me ask you this question. How confident were you that you were going to improve in your symptoms of breast implant illness? Like going into the case, because it's a big deal. You're going to invest the money, you're going to physically come in here, you're going to spend time, you're going to recover, you're going to be cut open again. It's like you have to be convinced beyond like any doubt that this is a big deal. Like, that's a strong-willed person.
Yes, I feel like after doing the research and coming across you, I mean, I really felt like I was 100% confident that you take the time. My surgery was 4.5 hours. My first surgery was 45 minutes. And I appreciate that you don't rush. You take however much time is needed for each individual case. And not a lot of physicians will do that. And so I was very confident. I mean, it was very frustrating, disappointed in myself that I had 27 years of implants and I had never even heard of breast implant illness
Your
until
surgeon
March.
told you that you would live with your implants forever.
Yes, the first surgeon did. And then actually the surgeon in March, he thought that he told me it was all in my head, breast implant illness, and kind of, mocked me. And, when I went in for my follow-up after I'd done some research on breast implant illness and the rupture, he just said I needed to stay offline and not let that stuff get in my head. And, which is interesting. He said he would have a follow-up appointment with me. And so after I had you show everything, he wouldn't show everything. He actually kind of mocked me when I asked for the implants back. And when I got back after you videoed everything, I sent it to him, and he said he removed me from of the follow-up appointment. He canceled it and didn't want to have any further contact with me.
So this is where, this is happening, unfortunately, because no one wants to listen to the patients. As simple as that. If the surgeons just listen to the patient's complaints, because you're not deriving pleasure from this, right? You just want your life back.
Right.
The problem is happening because no one's listening to the patients. You're being dismissed. I will tell you, when I first started listening to my patients, I was laughed at by other colleagues, other anesthesiologists, CRNAs, plastic surgeons, who said, that you're trying to capitalize and fearmonger my patients into coming. I would love to do 8 implants today in the time that I spent the time and make a whole lot more, and my neck and back certainly will be a lot happier, right? Now the bottom line here is, look, there is a revolution going across not only in the US, but all of Europe and South America and the Middle East, and patients are beating the system. They're overriding their local plastic surgeons. They're getting the power in their own hands, because you know what? It's improvement in the health, in the sight, in the face, in overall in every organ system of the body, because the implants are causing harm. And this is history reliving itself. And guess what? There will come a time where not only this time around the silicone implants will be banned, but saline too, because remember, saline implants cause the same hurt. Now, the one thing I want to mention here is, how do you know that your surgeon did the right surgery? Number one, we already talked about this, that your surgeon is giving you the high definition pictures and videos of the chest while showing complete removal of the capsule. That by far overrides everything. That your surgeon is showing you the ribs, that the periosteum, perichondrium, the fascia of the intercostal muscle, fascia of the serratus was removed, and the surgeon is transparent, meaning he's showing you. What could be more transparent than that? Number two, the length of time is plus minus 4 hours. In your case, it was 45 minutes, so that automatically is a red flag. Number three, your surgeon is sending the capsules off to pathology. Because if the surgeon removed like 2 centimeters or 3, and you had a 560 cc implant, you have to have at least 13 or 14 centimeters of the capsule. So we know clearly a surgeon did not remove the capsule. And this is why some surgeons are not sending the capsules, because they're removing pieces of it, because they're not completely removing the capsule. If you want, any of my patients want, you can go to the pathologist and say, I want to see my capsules that were removed. That's the high definition pictures. You can go to your own surgeon, any of the patients, and then ask their surgeon, where's the pathologist? And that will be the ultimate proof, because what was removed, and then you can make and look at your capsule and say, aha, look at the size of this capsule, it is partial, right? It was 20%, 30%, 70% removed, and there is capsular tissue left behind. And that's why one of my colleagues, when I talked to him, why do you not send the capsule? He said, I don't want proof that I did it partially. So that's number 3. Number 4, your surgeon is returning the implants to the patient. So there are many patients that I've taken care of, the saline implant is ruptured by the other surgeon and then pulled out, and say, I tried to remove the capsule, sometimes through the nipple areola, sometimes through a small incision. This is not how explant surgery is done. You have to be able to safely visualize, completely visualize, and get all of that capsular tissue removed. Number 5, the reputation of the surgeon. this is also very much key. If your surgeon is putting in implants, so like this one plastic surgeon, she now goes back and starts to now put in implants, automatically her explant quality, all what she says goes down the drain. If I put in one implant tomorrow, which will never happen, all what I've said today goes down the drain.
Right.
All my videos, all my Facebook, because there is no strength and validity to it. And number 6, so this is very important, the reputation of the surgeon. Not only the surgeon, but the surgeon's practice. So this is what's happening. The patient goes to a surgeon who says, oh, I love my patients with breast implants. I have an advocate that I pay, and she goes out and portrays herself to be the patient advocate. That advocate is not gonna operate on the patient. That doesn't mean, this is good marketing. Advocate means nothing in my eyes and in my mind. Because if I have 10 people advocating for me, no, we want to see the proof. There is no such thing as a patient advocate. There is only the surgeon talking to the patient and the patient being the advocate for the next patient. And that is the ultimate proof. Because this advocate is being financially compensated to say whatever the doctor wants. So that means nothing that the advocate says, oh, this person is, my surgeon is the best. No, because you're being paid. So the advocate part does not mean anything. You want to hear the surgeon directly, not the PA, not the nurse practitioner, not the advocate, not the receptionist, but the surgeon himself must be involved. And in that entire entity, that practice, there is no other person who's augmenting, because this is what one of my colleagues said. Whenever and I wish I could, out of professionalism, say the name, and I want to say the name, but out of professionalism, I will not. Whenever anyone wants to explant, I am the person, but whenever anyone wants to augment, the front desks diverts the patient traffic to the other surgeon who's putting in implants, because that way we capture both of the worlds. This is 100% unethical, unprofessional, and morally wrong for someone to capitalize on patients' insecurities or basically tricking the patients.
Right.
And number 6, the length of the incision needs to be what is approximately the length or the diameter of the implant. So this is where someone had like a 420 cc implant and she already had her supposed end block, and the next thing you know, you see the incision is 2.5 centimeters. I say there is no way that your entire capsular tissue was removed from such a small incision. So that in itself is ultimate proof. And this is where all of this, if you factor in, you put the 2 and 2 together, you will have that determined confidence. If your surgery was done today, you will know from the bottom of your heart, you'll have that peace of mind and the tranquility that the surgery was done in the manner described, because this is the ultimate check and balance. This is where your surgeon is proud to be an advocate. The surgeon is talking confidently. Now remember, there's a lot to the practice in addition to what we just talked about. It's all about the safetiness. We talked about patients getting dilaudid from pain doctors or other doctors. We're talking about patients getting 120 Norcos, I'm not exaggerating, from their surgeons. It's a lot of pain medications. When I was in California and my patients were basically getting the scripts, the pharmacist called me and said, what's a doctor in Michigan doing in suburbs of Los Angeles? Writing scripts for a patient who is from Washington State, another patient from San Diego, another patient from halfway in between San Francisco and Los Angeles. And so the pharmacist called me and I said to the pharmacist, go ahead and go to my NPI number. This is the National Provider Identification Number. So every MD has like I said, go ahead and Google me and look me up. You're gonna find I'm gonna be in the bottom 0.1% of pain medication writers. And she said, I already looked you up and you're as legit can get. And we all have a track record electronically by the patients. The patients who are talking about me, the thousands of patients who are on my Facebook group, they DM my other patients directly. So there's no censoring there because I'm already talking to my patients, right? So there is no, you can DM all my 16,000 or so patients that are on my, and you can get all the answers you want. I'm not censoring that. Every surgeon, if you ask me, this is what I tell anyone and everyone. Make a Facebook page or a YouTube page where someone who has no political influence, no financial influence, no money exchange. The moment there is money exchange, there is dirt. There is unprofessionalism, there is unethical behavior. The moment there is money exchange in even a $20 transfer, there's, you know, the purity of this knowledge and communication goes down the drain. There should be and maybe you can do this. You come up with a surgeon X. How long is the surgery? Does he do videos? Is he purely explanting? Is he augmenting? Does he allow his patients to talk to one another? Because that's the ultimate check and balance on me. I may not have a marble facility in Los Angeles with a nice high-rise overlooking Wilshire Boulevard, but I promise you one thing, you'll get the best pictures that you deserve so that you have the confidence that you got the best surgery in a very safe, ethical standard, you know? And this is what we want. Look, in the world of explant, you want purity, you want clarity, you want that confidence that your surgeon is a believer and is honest and respects you, so that when you do sign up with your surgeon, you have that peace of mind that you got this peace of mind. Yeah.
Yes.
Because I will tell you, you know, what makes you who you are is your faith too, you know, and your, I think, clarity in your mind. Because I remember when I talked to you, you were already so well informed and knowledgeable about this that you knew that you had to get this done, and you knew in your mind that you were going to get better.
And I knew that I would have the peace of mind that I needed from you based on your procedures and the photography and the videoing. And it's, you know, it's a little extreme to watch yourself like that, but it also brings such peace of mind that I know that, and that you have done everything possible for me, and I've done everything possible. And now it's just, you know, the journey of my body continuing to heal without all the toxins in it.
Right. Yeah, no, you mentioned a very good point. So I did a Facebook Live with this nice lady, 71 years of age, from Washington State. She came to me and I asked her what type of research. I did a Facebook Live with her, and it's right here in Michigan, and I asked her, why did you come to me? And literally she said, I have blind faith in what you said. I never saw a single video.
Oh, wow.
Because she could not watch. When she came to me in the post-op clinic, I said to her, please watch what I removed. So when you see the pathology report, it will make sense to you what I removed, because you want to know what is going on. And I say this to my patients, it is not a suffering to watch yourself, it is power. That is power in a sense, so you have mental closure. This is what came out, this is what was tested, because that is the ultimate proof, right? Why you went through the whole process of the surgery. To date, whenever I show the patients their pictures, I want them to know what I did. Because remember, that's the bond that they have. I may have a nice suit, I may have a nice hairstyle that day. This is unfortunately what I see on Facebook and Instagram with the many other surgeons. Nice setup, nice this, nice whatever. But when it comes to any pictures or videos, there is none to be shown. When it comes to the capsules to be sent to pathology, pieces of which are sent because it was incorrectly, incompletely done. High definition pictures and videos, oh no, I deleted them and I showed them to you and pack you. No, you're completely amnestic to the event. This is not how it's done. So the surgeon, the point I'm trying to make here is there has to be ownership and responsibility by the surgeon, so that when you get done, you have that peace of mind, like I said earlier, and you, like you said, so that you have that determination. And I want you to, you know, watch and see one of the reviews that I saw, one of the patients that I was showing one of my patients. I said, no, I want you to see what you invested in, so that when you get done and when you see the pictures and videos, I'm trying to highlight to you what is the black mark, that's the bovicari. This is complete removal of the capsule, and now you're seeing raw muscle. Here you do not have, and I'm showing the patient, you do not have any capsule remaining all the way into the upper part of the chest, because this is what happens in my practice. I see a lot of patients, such as in your case, where they have gone to other surgeons and the surgeon used the word en bloc, and you see there's partial capsule removal. So the word en bloc should not apply. I see the word en bloc very loosely used. I see no pictures, no high definition videos. And unfortunately, there is no consistency from one patient to the next. We did a Facebook Live with one of the other plastic surgeons who said, when it's the easy cases, I take all the pictures and videos and I post it. When it's the more difficult, we're trying to not show that because we do not want to show impartial capsules. And this is where removal of the capsule, this is a very important point also. Removal of the capsule needs to be done, which means physical elimination, physical removal of the capsule. And if you have if these are the ribs, and you have a glove that's sitting directly on top, and in order for me, and I'm gonna just demonstrate that because this is gonna sink in, this is an important point. So if you have a glove, and this is a capsule, and let's say this is a ball, this is the implant and the capsule, and these are the ribs. In order for me to remove the whole capsule and the implant as one piece, I have to remove some of this skin that's directly adherent to, and then the fascia of that muscle that's in between the ribs. I have to remove the fascia of the pectoralis minor, and I have to remove the fascia of the pectoralis major if the implant is below. Because if this skin is not removed, this is the fascia, then you will have a tear in this and the silicone might leak out. And so this is where, in order to remove the whole capsule, which is the glove, you have to remove the fascia of the ribs, the perichondrium, periosteum, the fascia of the pectoralis minor, fascia of the intercostal muscle, fascia of the serratus anterior, because that truly ensures that the en bloc was done. Now, let me ask you this one question. How much, now it was in March that you had your surgery,
Yes.
and in 2 months, you were on the OR table.
Yes.
That's like, in 8 weeks from the time you explanted, you were like already here. So this is very, because I was looking at your timeline, because normally some people are like 6 months, 2 years. I have a nice lady, doctor's wife from Utah. She came to me 2 years after, and she saw excellent improvement in her residual capsule by me, but she waited some time because remember, when you and I talked, I normally tell the patient, listen, you just had your surgery done hours ago. Stay at home, maybe you might improve.
I just knew that the last 6 years of my life where I felt like I was dying, I was gonna do everything I could to expedite that, and I wasn't gonna wait longer or another 6 months. And we pay for this out of pocket, so the first surgery was like challenging, and then to think that I had to do this whole surgery over again with all those expenses. But our health, there's no value on our health, and so I was just so thankful that you were able to get me in and to do that. And
right, so for me, what was the test when you said my surgery was done in 45 minutes? So I said you cannot remove the entire capsule in 45 minutes. You definitely have residual capsules, and you deserve the right surgery fast. You don't want to heal and then in a year's time come back and redo this whole thing. You're still in the healing phase. Come to me now. I will get the entire capsule out, and we will let you heal technically just once, except for those 2 months. And so there was an urgency on my end.
Yes.
That's why I plugged you in sooner rather than later. We had a very long clinic today, and I must mention, the last patient that we had was a patient who had rheumatoid arthritis. MRI shows a right rupture, and now the clock is ticking for her to get the explant because she is hurting. She's got a capsular contracture and sign symptoms of breast implant, almost through the roof. She checked almost every box. The patient before her, she had implants from 1982, very likely both ruptured. And you know, this is unfortunately, you know, I invite other plastic surgeons, I invite the FDA, I invite RFK, I invite anyone who my patients allow and just listen. You know, it is a clinic. I had a patient today from India. She came all the way from India just for her surgery. And we will hear from her. She is hurting. She is in misery. I don't care where you're from, as long as you're from planet Earth, you're a human.
Yes.
And we hurt in a similar way. We have the same symptoms no matter where we are, what part of the world we live in. We will hear from her directly as well, just like you. You know, I'm very grateful to you. You're not even supposed to do the Facebook Live, right? But you took your time and you're spreading the message.
Yes.
There's a lot of good, solid information we have talked about. There's strong information, strong message from your words. How determined, how, I use the word knowledgeable you were, because you knew that you're investing in something that's only gonna help you. Do your homework, do your research, talk to the surgeon direct. That is the key. Your surgery, you need to know what you're signing up for. You will know from your heart, mind, and soul that this is the right surgery. On my end, I'll say two things and then I'll let you finish. Patients have almost always said two things. They wish they had never gotten implants, and they wish they had removed them sooner so that they would have gotten their life back. No one should do a surgery where the first line of this says breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Do no harm. It's not worth it. If the patients do not understand and they're being told that they are safe, it is misinformation, wrong information, because ultimately the patients only regret. If the patient wants the implants, make sure they have the informed consent, because the majority of them do not know. 90% or over do not know, at least the patients that I've managed, they had no clue what they signed up for. And this is where the power of informed consent comes in, not only when you are getting the augmentation, equally importantly, when you are getting the explant. Remember this, for myself included, plastic surgeons, we were truly never taught how to do an explant with the whole capsule. This is on-the-job training for all of us. No two surgeons will be the same. There is no criteria that describes how to doing it. And every surgeon has their own formula. Oh, this capsule looks benign, small, thin. I'm gonna cauterize it, put drains in, wash it out, call it a day. The capsule will dissolve. Wrong answer. It has to physically be removed. And every surgeon has their own personality, their own respectful way of doing it. You wanna do your homework so that when you sign up for an explant, in your mind, you have that smile, peace, and that tranquility that your surgeon will respect you from the beginning to the end, so that when you get the surgery done, you get the best surgery done. So that, this is what I have said in my many Facebook Lives, 20 years from now, I cannot imagine anyone else being more complete. Now, having said this, I will let you finish.
One thing also that you have mentioned that they don't tell you is a young woman in her 20s will probably have 6 surgeries throughout her lifetime, if all goes well. And we certainly are not informed of that, because who wants to have 6 surgeries that are at our expense, and that's if nothing goes wrong. And you just educate yourself. One thing is if the surgeon's putting it in, they're not gonna be an advocate for removing them, which I did not, I wasn't aware of. And just the peace of mind. It is a little hard to watch the videos and see the photos, but it truly does bring the peace of mind that you need. And I appreciate you taking the time that's necessary. I know it's hard on you, your body, to remove to the best of your ability so that, we can have our lives back.
Right, no, just want to mention, there is no choice. So one of my patients, that nice patient that came for a round 2 consult, I've already talked to her. And she said to me, this sounds like very invasive. And I said to her, one of the gallbladders that I saw that was removed was very gangrenous, inflamed, and angry. Guess what? It had to be removed.
Yes.
The brain tumor on someone that I know 3 weeks ago who had his surgery is very tedious surgery. It has to be removed.
Mhm.
That other fracture of the hand, and it is very complex, or a mangled hand with table saw injury has to be repaired.
Mhm.
Likewise, explant surgery is tough,
Yes.
invasive. Guess what? It is still done outpatient in a very nice, defined way. Patients are discharged to home. Even the 89-year-old lady I
Mhm.
operated
Yes,
on,
yes.
discharged to home.
Mhm.
She met criteria for discharge. That patients, all of them from California, who I discharged along with my anesthesiologist, they all met criteria to go home. Their SATs were fine, their pulse ox was fine, their intra-op course was fine. They all met criteria, and this is what is surgery. Surgery is not easy, and I will tell you, it is not for everyone.
Mhm.
It requires a special mindset. First of all, you have to believe in it, that it needs to be done, i.e. the whole capsule needs to be removed. Because if you're not a believer in it, how are you going to even carry out the task of removing it?
Mhm.
And that requires a determined mind in order to remove the entire capsule. Because if you're not going to believe in something, how are you going to even do the surgery?
Mhm.
If you don't believe in a revolution, how are you going to even carry it out? Meaning, if you don't believe in a job, how are you going to perfect it, right?
Mhm.
And it has to be done, I use the word perfectly, and this is where you look back at it, not only your surgery, all the surgeries last month, last year, there is that confidence that it was done in the manner as described. And the other thing I want to mention about the 6 surgeries, what you mentioned is very wisely, on average, the implants last 7 to 10 years, plus minus 10 years. So if a young lady in her 20s, let's say 22, gets silicone implants,
Mhm.
at 32, she's going to get her first replacement, 42 second, and the average American lifespan of a female is 82 plus minus, depending on which part of the country. And you will see if she lives to 82, you have to have them replaced 6 times. And this is where the cost is incurred by the patient. And this is where there are not lifetime devices. You hear of F-150s driving or implants and not being ruptured. That might be true that day, but there are so many ruptured implants that I've removed. You all have seen that from the Facebook Lives.
Mhm.
Those need not be driven over an F-150 because the patients were keeping them in their body. They are not lifetime devices, as you heard the FDA. They disintegrate, they melt,
Mhm.
and they're certainly not that gummy bear cohesive when they disintegrate, even the newer generation ones. They are definitely, I use the word replete with problems,
Mhm.
and not many patients are aware as to the detrimental effects. And this is where I want each and every one of you, go to YouTube, go to Google, and pull up this article, breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff. September 29th, issued September 29th, you will have all what you're looking for right in this. And they want you, ironically, they want you right here, after every line that they discuss, patient initials, patient initials, patient initials. And then it says over here, quote, this is the surgeon. I acknowledge that I've discussed the benefits and risk of breast implants as described elsewhere in the patient information booklet brochure and in this checklist. I have also explained the benefits and risk of the alternatives. I have encouraged the patient to ask questions, and I have addressed questions. This is what happens. The patients go to the docs and they say, oh, that's all for social media.
Right. Mhm.
Implants are the safest devices that have been invented. You deserve the best. Sign here. We got an opening next week. Congratulations.
And I was assured when I had the gummy bear replacements, that would be the last time I'd have to have them.
Misinformation, wrong information,
Mhm.
and this is absolutely far from the truth.
Mhm.
So, no, thank you very much.
Thank
Thanks.
you.
I
Thank
appreciate
you
it.
so much. Yes.
Please ask, do you have any questions? Anyone has any questions?
If you could just let everyone know where you're located.
Yes, so we have 2 locations. Our location here is in Bloomfield Hills, Michigan, executive plastic surgery, Dr. Khan. And then also in the suburbs of Los Angeles, Northridge, California, where I go every 4 to 6 weeks on average. And so this is where I do the surgeries. We were just there last week. And for those patients who were asking, I took my first assist, my same equipment. We literally reproduce whatever we do here in Michigan in Los Angeles. We even took the weather with us. It was raining nonstop that entire, believe it or not, it was 64 degrees in Michigan that day.
Yeah.
And it was cooler in Los Angeles. And
funny.
my patients know this who live in Los Angeles. We even took the weather with us. And so it was literally reproducing the same thing that we do over there, because it's again the mindset.
Right,
It's a mindset.
right, yes.
So
Thank you for all that you do.
no, you're
Yes,
welcome. My
yes.
pleasure, my privilege, and this is what I signed up
Yes.
for.
Yes.